My next guest has outlined a rigorous 6-point plan that he says can defeat this pandemic by early June if we're all willing to throw in and try hard enough. We welcome to the broadcast Harvey Feinberg, president of the Gordon and Betty Moore Foundation and the chair of the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats. If this isn't one, it'll do till one gets here. He's also former president of the Institute of Medicine, now known as the National Academy of Medicine, happens to be the former dean of the Harvard School of Public Health. Let me get to your list so we don't waste a second. Here are your 6 points. We'll critique as we go. To crush COVID-19 in 10 weeks, you are calling for establish unified command. We don't have that. Make millions of tests available. We don't yet have that. PPE and equipment to hospitals. We don't have enough. Differentiate the population into 5 groups. That I need to come back to. Inspire and mobilize the public. I'm pretty sure we haven't done that. And learn through real-time fundamental research. Right now, it seems to me we're doing basic triage, but I hope our smarter angels are already engaged in that. So if you can back up to differentiating these 5 groups, that was a fascinating idea.
Well, thank you, Brian. It's a pleasure to be with you. The basic idea is if we are in this as a war, we should be in it to win. And to win, we have to do a great deal more than we are doing. One of the critical elements, as you pointed out, was to understand who in the population, first, is infected. Secondly, is presumed infected because they have all the symptoms, but they haven't yet tested positive. Third, is someone who's been exposed but not yet infected. So those people should be in quarantine. Fourth, those of us who have neither developed the infection nor, to our knowledge, been directly exposed to someone with it. And finally, those who have recovered and presumably have some degree of immunity, which can also be tested.
We're watching these states, one after another, late in this process, see the light and tell or ask their citizens to stay indoors. It seems to me for every state not under such an order, that threatens the herd. But there is a self-reward for doing what you and I are doing, staying indoors and away from other people. It's your way of making a tough outer shell on you that's going to resist this.
It's basically distance by physical separation that makes it harder for that virus to find someone else to infect. That's the whole point of our work from home, stay at home, shelter at home, that whole concept. That's likely to reduce the frequency of the spread. But unless we're much more aggressive about testing and differentiating the population into those 5 groups and then acting on that information, isolate the cases, quarantine those who have been exposed, keep others away from the exposure, we're not going to really win this war.
Well, as you know, as a well-read guy, wars are won in part based on leadership, central leadership and terrific battlefield leadership. We don't have any one person. I'll try to keep you in medicine and out of politics, but if you had your druthers, would it be one of the many highly qualified retired generals in our country, many of whom are quite active and vocal on social media? Would it be a Dr. Tony Fauci? Do you have a candidate who you wish would rise up and lead this thing?
The most important thing is, first, whoever it is who's our commander in the field, who reports directly to the president, has to have the full confidence of the president. That is essential. It took Lincoln a while before he found his Grant. President Trump needs the equivalent. Secondly, this individual has to understand both the government and the health scene. This is someone who also knows about state and federal relations. This has to be someone who is well respected, very knowledgeable, and decisive in decision making. There are a number of people, Brian, who could qualify. Just to name one, to pick a name out of the air, former Governor, HHS Secretary Mike Leavitt, kind of person who succeeded in running a department, very complicated, well organized, able to get things done. If you reach across the aisle, you have Ash Carter, former Secretary of Defense, extremely brilliant, great history in logistics. Maybe you get both of them. Maybe one is in charge and one manages different aspects of the program. We need the A team brought together under a unified command to direct this effort in a way that avoids a lot of the miscommunication, misunderstanding, lack of coherence in the way we're approaching this problem. Just think about the way we've tried to settle the ventilator shortage problem, each state out on its own, and then FEMA and the federal government overlaying its work on top of all the states. This should be a coordinated, unified, thought through effort so that we can share effectively all of the ventilator capacity by region.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.